Good evening, dear friends. And we are here again, welcoming you all to the 10th edition of Heart Talks with Dr. Chinu. Today's episode is really a special one because we have a guest of international repute, a very renowned REBT therapist and teacher, and also an author of a whopping 240 books with us today, Professor Windy Dryden. Welcome, Professor Dryden, to our show.
I'm pleased to be here.
Thank you. Professor Dryden, I have known you since last 22 years, since 1998, when my teacher, Dr. C.G. Pandey, introduced me to you and your work in REBT. And he was one of the first people to get trained in REBT from Dr. Albert Ellis himself. Professor Dryden, I would first like to ask you, for the benefit of our audience, about your own journey in the field of psychology and psychotherapy, if you could tell us briefly about that.
Well, I started to train as a counselor back in 1974 and initially was trained in client-centered therapy, but it didn't really fit with me that well. So I decided to, I got interested in REBT, or it was, as it was known then, RET. And I did some training in England, but then I realized that in order to get properly trained, I'd need to go to America, which is what I did in 1978. I then spent 6 months with Aaron Beck in Philadelphia. In between that, I did a master's course in psychotherapy, and I've been working in a variety of settings ever since.
Okay, and Dr. Dryden, you are one of the first people to be trained in REBT in UK, and you are one of the leading practitioners of REBT in UK, right?
If you say so.
Yeah. Also, you have trained psychotherapists in many countries around the world. You have even co-authored some books with Dr. Albert Ellis himself on REBT.
Yes, indeed. Yeah. Yeah, one of my favorite books is called REBT in India.
In India, yeah.
Yeah.
And Dr. Dryden, I'm so intrigued by the volume of the books that you have produced in a lifetime. I mean, we can't even read so many books, the number which you have already written and authored. And all of your books are so useful and so practical, systematic, and simple.
Thank you for saying so.
Yeah, and I congratulate you for your latest book, which has come up, that is helping yourself with single session therapy.
Well, actually, 2 other books have come out since then. So,
in the last 1 week or 10 days?
Yes, in the last 1 week. Yeah.
Congratulations for them too.
Thank you.
Professor Dryden, what is single session therapy? In today's 1 hour talk, we are going to focus on single session therapy. And how did you move from REBT to single session therapy? What attracted you to single session therapy?
Well, let me ask, you asked a number of different questions. Let me take them in order. Single session therapy is actually a name which is not what you might expect. You might expect it to be a single session therapy is therapy conducted in a single session. Now, it can be that. And whenever I do live demonstrations of my work on training and educational workshops, it is that, because the volunteer knows that there will be no opportunity for us to meet again on this. So it literally is what some people would call a one-off session. But single session therapy itself is a name that is given to a situation whereby the therapist and the client meet with the purpose and the intention of helping the client in one session, but on the understanding that more help is available if the client needs it. So the idea is, let's see if we can help you in one, but if not, more will be available. And the client is fully aware of that. That's the informed consent business. Now, I haven't exactly moved away from REBT because, in a way, single session therapy is not an approach. It's a way of thinking about therapy and a way of delivering therapy services. So the beauty of single session therapy, from my perspective, is that people from different therapeutic orientations can practice single session therapy from the perspective of their own orientation, but with the single session therapy clearly in mind, in one's mindset. So I still practice REBT. I bring my REBT insights to single session work, and but I also practice REBT over time, and so it depends upon the client. I think you mentioned to me when we were just chatting before we got on air that in India, and the word you use is drop out. Now that's an interesting word, drop out, because what does drop out mean? Now in our field, drop out tends to mean when the client doesn't stay a particular course of treatment. So for example, they the therapist and they may have agreed that they're going to meet 6 times, 12 times, but the client, in quotes, doesn't come back. Now, in single session therapy, we have a different idea about that. And that is, it's the client's decision not to come back for some reason. Now, quite often, the client decides not to come back because they have been helped, right? Sometimes it's not that. And because we really don't know what's happening, we tend not to feel very good at it, about it. The word dropout is the idea of something bad happening, whereas actually a lot of the time something good has happened. The client's been helped in that one session. They think, thank you very much, that was helpful, I don't need to come back again. Some of the time is actually, no thank you, that wasn't very helpful, I'm not going to come back again. And quite often we don't know which of those two cases is actually the truth. We think as therapists that when people don't come back, it's bad. And I'm here to tell you it's not necessarily bad. Can be good.
Okay. Yeah. So you said that, the client might have been helped in the one-off session that we took with the client. And so he decides that that was enough. And now, from now on, I can take care, or I can cope with my own problem with that one session. Or the client feels that I don't need this therapy, I am not helped by it, and he decides not to come. So dropout is not always a bad thing. But research actually about psychotherapy tells us that there is a very big number of people, 40 to 60% of people who do not come back for a third session.
You mean they come back for 2 sessions, but not the third session?
Not the third session. So for example, if we have planned 12 sessions, we find that the client doesn't come back after the second session mostly. And there are many researchers which are now quoting whether the therapeutic alliance was strong enough, whether we have actually understood the client's problem, whether we could help the client in the way he wanted us to help, whether we were empathetic enough. And there are so many factors which are being taken into consideration. But the 2 most important factors which have come up in the research after surveying these people who have dropped out, they have quoted cost and time to be their constraints. They say that therapy is very costly, and they say that they don't have enough time to invest in their own therapy. And so single session therapy might be a savior in that sense.
Incidentally, I kind of think that people who have a session and don't come back are somewhat different. than people who have 2 sessions and they don't come back. Because I think that in a way, if you don't come back after the first session, and now the research does clearly show that is the most frequently occurring number of sessions that people have is 1 across the board. And I think that the research shows that the situation is, I'm being distracted by these messages that keep coming up.
Okay.
So I don't know if we can shut the chat off, but
I don't know how
and they're big messages that come up on the screen. And what they're saying is hello. Well, hello, but it's a distraction. Okay, so okay, what I'm saying is that the most frequently occurring number of sessions people have is 1 followed by 2 followed by 3. When they have 1, they may well be helped. If they come back, they may not have been helped by the first one, and if they don't come back after the second one, they might say, well, I've given it another go. So it's very interesting to find out. What we lack is actually a lot of qualitative data about what happens after somebody has come for a therapy session or 2 therapy sessions or 3 therapy sessions, and what they made of it. Were they helped by it, in what way, or were they not helped by it? And so I think we need a lot more of that qualitative
analysis
data. Yeah. Now, in terms of the time, I think that time is an interesting factor, and that is the more if people think that they've only got a certain amount of time, that they'll utilize that time in creative ways. Whereas if you give them more time, they may well utilize that by not utilizing the early part of that time and doing the same thing, but just putting it back. So I think that I mean, the cost, again, I don't know how much therapy costs in India, but I can imagine that for some people it would be prohibitive, even if it's a reasonably small amount. So I think yes, but cost and is, although it's an important thing, I do want to stress that single session therapy is something that we go about by design, because there are therapeutic features of this way of working. Yes, it brings down waiting lists, it brings down waiting times. It may be easier, particularly now. People are not traveling for therapy because they can have it, like we're having it, over online platform. So I think that the time factor is, if you cut out the traveling time, then if people are saying, I don't have the time to spend half an hour or an hour with the therapist a week, then I mean, it's no good having single session therapy because they haven't got the time for it. But if they, so I think time in this online world is something kind of different than it was when we were meeting people face to face.
It has at least reduced 1/3. I mean, if you cut out the commutation time of 1 hour going and 1 hour coming, it has come down to 1 hour of actual therapy. And so online mode does facilitate time factor.
Yes, as long as you've got the right environment, to do it.
Exactly.
You've got the privacy, etc.
Yes. One more thing that I guess is very important in single session therapy is sometimes it may be an emergency setting. Sometimes you find yourself counseling a person in a setting where there is no opportunity for the person to come back for a second session, and that setting itself is an emergency. Like when we were talking last time, I informed you about the single session therapy that happened in the Bhagavad Gita, where Lord Shri Krishna is giving a therapy session to Arjuna in the middle of a battlefield. That is an emergency setting. And so I have found that so many times when we are counseling people in the hospitals where we don't know whether we are going to meet this person again or not. I
Well, that's
had
right.
worked in a
But even if you contract, let's say that it's not an emergency setting, and you contract to see somebody for, let's say, 6 sessions or 12 sessions, you actually don't know whether you're going to see them again. You see,
exactly.
so
Yeah.
the single session therapy is based on the idea. One of the ideas is that since we don't know whether we're going to see somebody again, let's how do we want to spend that one session? Do we want to spend that one session with them conducting a case history? Do we want to spend that time doing an assessment of them as a whole person? Do we want to spend that time doing a case formulation? Or do we want to spend that time doing 1 hour of therapy on something that they want to focus on? And I think single session therapy is the latter. It's saying, since you don't know if you're going to see somebody again, and let's proceed on that kind of basis. But let's do it on the understanding that the client is also fully signed up to going forward on that kind of basis.
Yes.
But in terms of what your other thing is, that there are plenty of instances in the literature of single session therapy interventions used in emergency situations and what they call now humanitarian situations. And so there's interventions after the Hurricane Katrina struck New Orleans. There's plenty of also evidence in post-disaster Haiti. People have written up about that. And there are in other parts of the world where therapy is very difficult to access. They have a therapy truck, and the therapy truck goes around the country, and you might have a single session with that person, and next time you come around, it's 3 months. So and so it's not a question of, okay, I'll see you next week or anything like that. And they don't have necessarily the online communication structure to actually do it over Zoom or anything like that.
That's a very interesting concept of the therapy truck.
Yeah.
And I want to now ask you, what is the standard duration of a single session therapy session?
Well, it depends upon the work that's got to be done and the setting in which you do it. My own experience is that when I'm doing live demonstrations, I tend to can do it within 25 minutes.
Oh,
and yeah. And in my own private work, I say to people that the session will be up to 50 minutes. Now, the word up to 50 minutes is important, because if I'm working with somebody and we can do the work that we need to do in 40 minutes, then I don't want to spend the next 10 minutes, because I've promised to see them 50 minutes, talking about the weather or anything like that. And so up to 40 minutes really kind of indicates that we can stop when we're done. Okay. In family therapy, I mean, I was just finishing a training yesterday to a university counselling service, and they have decided, their counsellors decided to increase their sessions to 80 minutes. Now, it may well be because I'm used to working in a single session way that I can work quite quickly, and also in this setting they've got certain things that they need to do that the agency mandates them, so which takes about 10 to 15 minutes. So in family therapy, for example, people would tend to do a single session of about 90 minutes. And there is a behavioral therapy, cognitive behavior therapy approach to the treatment of simple phobias for adults, children, and adolescents, called the one session treatment of simple phobias. And that can last for up to 3 hours, because there's a lot of exposure to be done. So you can see the variation in terms of length.
From 25 minutes to 3 hours.
25 minutes to 3 hours. The shortest demonstration that I've ever done was 3.5 minutes.
Wow.
Yeah, exactly. 3.5 minutes. And, if you know you've only got 3.5 minutes and the client knows that, it really does concentrate the mind. We kind of get rid of all the we throw out everything that we don't need. It's a bit like being on a raft. You throw out everything you don't need in order to stay afloat.
You can call it the elevator therapy. So when you are in an elevator with someone, you can just do therapy and come out of the elevator.
When I'm doing a training course, a question that I ask the therapists is, what information do you think you need about somebody in order to see them? And so they kind of come up with a list. And so again, my thing is to see how much we can throw out of the raft. And I'll say, well, if you didn't know that, and also I'm saying, look, okay, so would you tell somebody, I'm sorry, I can't see you for an hour of therapy because I don't know this about you. So, if we really take what's the absolute minimum? I mean, I don't need to know. I don't even need to know your problem. We could call it X, and I could work with X. I don't need to know your name. I don't need to know, anything about you in order to help you. And that's a very freeing concept. Trust me,
And Dr. Dryden, isn't it amazing that we have come such a long way from psychoanalysis, which used to take up years and years of therapy, and now we're talking about something like 3 minutes or 10 minutes or 25 minutes of therapy. And
yes, I mean, I'm not recommending 3 minutes. I mean, I think all I'm saying is if you've got 3 minutes, you'll use it. Not that I'm not, I don't want people to say, look, Professor Windy Dryden has pioneered 3-minute therapy. Although actually, talking about 3-minute therapy, I do have a colleague called Michael Edelstein. He has a book called 3-minute therapy, but he doesn't mean that the whole therapy takes 3 minutes, but the book's called 3-minute therapy. So so I don't want people to kind of to run away with that particular idea. What I'm saying is that if you are flexible enough and agile enough in your thinking to be able to help people and to cut out all the extraneous things that that we were taught, people still believe that you need 5 to 10 sessions to form a therapeutic relationship. Well, you don't. You can actually form somebody quickly. It's I don't know if you have it in India, something called speed dating. Do you have speed dating? Well, if you talk to people about speed dating, particularly women, the woman knows in the first 30 seconds if they want to see this guy again, you see. So you've got 30 seconds to form a good impression. I'm not suggesting that you do that.
Let me inform you, in India, when we are, set up for arranged marriages, I hope you have been to India so many times, so you must be aware of the concept of arranged marriages. And Vernon gets very, amazed by this concept. So the boy and the girl, the families meet for hours together, but they allow the boy and the girl to meet for maybe 5 or 7 or 10 minutes to decide whether they like each other and say yes or no. And so maybe that is something like speed dating.
We can have loads of therapists and loads of clients, and we spend a couple of minutes and see who wants to work with one another. Interesting concept. But all I'm saying is that you can, and research shows you can, and you do form quick relationships with people in order to be able to help them. And there is research that shows it. People who have a single session, who have a good alliance with a client, the client will get more out of the single session than the situation with alliance isn't very strong. So the alliance is important, but you don't, how do you spend the alliance? How do you strengthen the alliance? By really focusing on what the client wants to focus on, to really treat the client in the way that the client wants to be helped, not to try to shoehorn them into the way that you think that they should be helped. I think that's important.
Yeah. And another question I have is, in what kind of problems or disorders do you think single session therapy can be applied?
Okay, well, I've just finished my latest book, by the way. I finished it this morning, right? And the book is going to be called Single Session Therapy: Responses to Frequently Asked Questions.
Okay.
And that is one of the most frequently asked questions.
Ask questions. Yeah.
But
the
it comes from what I call conventional thinking about therapy. And conventional thinking therapy says this: we have this thing called therapy. We have this thing called clients. We need to assess the clients to see if they're suitable for the therapy, then give them the therapy. And then that leads up to the question, well, what problems and what disorders are indicated and not indicated? And that's a good question, but from the wrong mindset from a single session point of view. Because a single session therapy mindset is saying that the only way that we'll know if a person has got something from a single session is to give them a single session and see what happens.
Oh.
And yeah, and we have something called a walk-in clinic. Now, the walk-in clinic people would say, again, your question is not what we do. We don't, there's not a walk-in clinic and then there's, if you like, a table where you kind of work with, oh no, wait a minute, no, you've got this problem, you can't go into the walk-in clinic. No, everybody can walk in to the clinic. And, and again, the focus is what they want to walk away from. Not, we're not interested in what disorder they have necessarily. We're interested in what they want to walk away from. And we know from walk-in clinics that people with very chronic, severe problems go to a walk-in clinic and walk out with something that's meaningful for them, that it's going to help them going forward. They haven't been cured of their disorder, but if you can help somebody in a very focused way to walk away with something meaningful. Let me give you an example. There's two guys, pioneers of single session therapy by walk-in, called Monty Bailey and Arnie Slive. They talk in one of their books about the idea of this question: who do we treat? They talk about, says we don't treat somebody with psychosis for their psychosis, but we can help somebody. For example, this guy was sort of like talking to himself, and his landlord wanted to evict him, and so what they helped them in that hour was how to talk to the landlord so that the guy didn't get evicted. Now, he's still psychotic, right? But he's got a roof over his head, as opposed to if you say, oh, sorry, he's psychotic, we're not going to let him. He could have been psychotic and on the streets, you see? So, so that's the help that he wanted. And I think that that's the real thing about single session therapy that I really do like and value. It's giving people help to what they want, not what we think that they should have.
Yeah. I remember one incident in my own life when I was going to take up a session for 100 teachers. I was going to take a full day workshop with them. And I had to travel from Agra to Delhi. And I thought that I'll have ample time to prepare in the car. But somehow we got lost on the way and I had to keep looking at the GPS and I couldn't prepare. So we reached late and I had a session early morning. So I just messaged one of my teachers that I'm feeling very nervous. So he asked, what is your nervousness about? And I said that because I'm going to talk to teachers. And he just said one sentence. He said, but then they are going to be your students, right?
Yeah.
And that one sentence itself changed my whole outlook towards the situation.
Yeah. And you see, that was done, that wasn't even done in 3.5 minutes.
Yeah.
Probably about 3.5 seconds, you see.
Yeah.
Now we're not going to kind of, I don't want anybody to go away and say, Professor Dryden's got this 3.5 second therapy, because, no, but you see, I think this is a very ample demonstration that you said there, that how a way of looking at things can be radically shifted. I have a similar story that I like to teach as part of my, there was this sort of woman who was very wealthy and very highly strung, and she booked a penthouse suite in a hotel, and the hotel was instructed to be absolutely no interruptions whatsoever. And so there were 2 penthouse suites, and she had one of them, and all of a sudden she heard a piano play. And she was outraged. She went down and said, look, I've asked for this, blah, blah, blah. And the manager said, do you know who that is next, who's playing the piano? She said, no. Who is it? He said, and he mentioned the fact that he was this very, very, one of the world's leading pianists. And then he said, madam, do you realize that you're getting a private concert just for yourself? Completely changed her mindset.
Yeah, exactly.
Yeah. So these are the things that can happen. Change can happen. People often say, doesn't change take a long time? Well, no, it can do, but it can also not do. And what we do know, in a sense, most of the change in psychotherapy does take place early rather than late. And so we have this idea about, the longer the better, or more is more. Whereas the single session mindset is saying more is less and less is more. So, that's why I think what I want to convey to our audience today is that it's so important to actually do this work with the right mindset, the single session mindset. If you go into it with the conventional mindset, and then you say, well, how am I going to treat social anxiety? I normally treat social anxieties all in 12 sessions. How can I do it in 1? No, you could drive yourself mad thinking that. Utilize your conventional thinking for conventional therapeutic situations, but adopt a single session mindset when you're doing single session work.
Yeah. And so I understand, as far as our conversation for the last 30 minutes goes, is that single session therapy is about a mindset more than a therapeutic approach. And the mindset is most important to learn.
And to really grapple with, because people have lots of questions. That's why I did the book that I did, because people have a lot of questions about this stuff. Much more than when I do a workshop on REBT. Now, obviously, people have questions about REBT, I think that, but have a lot more questions. And so, hopefully, the book will find a publisher soon. I've answered 50 questions in this book that people are, tend to ask, about this stuff. But you're right, it's the mind, and there is a way of practicing that flows from the mindset. And then when you're reached the point where you're bringing about some change, then you can be informed by REBT or whatever it is that you generally practice, and there's no restrictions on in single session therapy. And that's why I like it, because it brings together, when you're just teaching people who are interested in REBT, CBT, then that's all you kind of talk about. But with single session therapy, it can I train people from a wide range of different approaches. So it's not necessarily linked to any particular therapeutic approach. But yes, you're right. The mindset is really important.
And I guess we can convert any kind of therapeutic approach into a single session therapy with the mindset that we need to help the client in this session itself intentionally.
I don't like the word convert there, because it's like you're using something and you're changing it to fit. I'm saying you're creating something and you're utilizing what is in this other building. You can bring it to this creation. So you're not converting it. You're
not converting. You're just utilizing it.
Yeah.
Okay.
Exactly.
And so what do you want to say more about this mindset of single session therapy? What can we keep in mind while doing a single session therapy?
Well, I think that I think there are a number of things that it's important to keep in mind. One is the creation of the context, and that is, if you create a context where a person thinks that they've got unlimited time to talk, then they'll approach the first session in a very different way than if they know that they've come together hoping that they're going to deal with their problem in that one session. Not particularly cure it, but to walk away with something meaningful. And so really creation of to really create the right context for realistic expectations. And that's the important thing, and that's why most of us in the single session therapy field who are not working in walk-in clinics, although in walk-in clinics you can still help people to prepare, because when you walk in, there's still a waiting time between when you actually kind of get to the clinic and when you see the therapist, and you can then encourage people to fill out a form which is helping them to prepare for that session. So even in walk-in, you can actually helping them to prepare it. Single session therapy by appointment is really saying, it's very important to prepare for this session. Now, having said that, and I've done over the years, I've done over 425 live single session demonstrations in the context of workshops that I've done. There's no preparation there. Maybe people have prepared once they've decided to volunteer. They've done their own preparation, but I don't ask them to do that. But so really preparing yourself. And something very interesting happens when you really ask people to prepare themselves. And normally it's done in a structured way. You've got a sort of preparation question. Some of the time they go through the questionnaire, and that stimulates them to see that they can deal with the problem without the session. So some of the time the preparation is actually sufficient. They don't need to have the session necessarily. Often, some of the time, what actually happens, also some of the time, is that when somebody finally decides to pick up that phone and make that appointment or whatever, that is probably the most therapeutic thing that they can do for themselves. And then once they've opened themselves up and say, yeah, I do have a problem, then rather than saying, no, I really don't, or they're trying to hide for themselves, yes, I do, then they start to kind of look around to see what they can do to solve the problem. I'm not saying all the time, but some of the time. So preparation is important. Starting the session well, I think that's so important. And I kind of experimented with different ways of starting a session. And one of the best ways I like to start the session is to say imagine you're my client, I'd say to you, what's the purpose of our conversation together? And so that kind of, then the client can tell me what they think, we're here for. And then I might say something like, if when you went home and you reflected on our discussion and you thought it was really a good session and you were really glad to have come, what would have led you to that conclusion that it was a really good session? What I'm trying to pick up there is to again, what the goal is. And there are different ways of asking the same question. Other ways of actually utilizing the time is to find out what they've tried before to deal with the problem and what the outcome of that is, because some of the time it's quite clear that their attempts to solve the problem have maintained the problem, and some of the time they may have done something which has been helpful, but they haven't capitalized on that. So you're looking for things that are helpful. The other thing about the single session therapy mindset is actually saying is that probably the client has actually solved the problem already in different contexts, but they haven't seen that they can actually transfer it. So I might say the question, have you ever had this problem before in other areas of your life? And you've actually kind of helped yourself with it? Have you done that? So again, you actually bring in, and then you're looking at what strengths they have as a person. You're looking at what the environment has to offer them that can be helpful to them. It's very much utilizing strengths, resources. It's that kind of mindset. As an REBT practitioner, what I have found personally very important in a single session is to really do a good problem assessment, particularly about what we call in REBT the adversity. I can really help myself and the client the adversity that features in their problem and really help them to identify that. And I think quite often people haven't dealt with their problems because they haven't been specific enough in pinpoint. Like if you go to a dentist and it's a difference between him treating you because he knows it's on this side of the mouth. That's not going to be good enough. You want him to take a precise X-ray and he says, yeah, can you see that shadow? That's the thing that we've got to treat right there. And that's the psychological equivalent about that. And again, this is me talking from my experience. If I can really help people to pinpoint what it is, and I think that REBT gives that, and I can do that very quickly. It's one of my skills. I can do that very quickly. And I've actually developed some other ways of doing REBT very, very quickly, which I can then bring to REBT, single session therapy. But some of the time I don't even use any REBT. So again, it really depends. The point is I can use it if it's necessary. And when I'm I give a Monday afternoon talk at it's 2:00. I don't know what time it is in India, but what time is 2:00 in India? Is it 7:30?
It's about 7, yeah.
Yeah, 7:30. So I give a weekly. I do 2 live demonstrations. It's at 7:30. It's for the REBT Facebook group. If anybody wants to sign up for that, they can look at that. But I'm doing REBT because it's the REBT Facebook groups. They expect me to do REBT, So and so so I do two demonstrations in the hour, so they take about 25 minutes each. And so working to really pinpoint the issue that people can focus on and actually deal with, for me is one of the kind of power of being able to do that in single session therapy. And then seeing if you can find a solution that people can actually take away, having an opportunity to practice that in the session if you can, to some degree, some rehearsal or to practice it is useful. And then to kind of come up with some action plan that people can integrate into their life. If they can't integrate an action plan into their life, they're not going to do it. So to make sure that they choose something that they can do, and then kind of reminding them at the end of the session that more help's available. Why don't they go away and think about the session, put it into practice? The thing about when you at the end of a first session, you quickly book the person into the second session. I kind of think that they think, oh, I've got another session booked. I don't have to, really kind of make them. Single session therapy is about making the most out of the session that you've had. And so I disagree. I have a very good REBT colleague, and he has a very fundamental different philosophy for me. He says the purpose of the first session is to have the person come back for the second session. My philosophy is the purpose of the first session is so that they don't come back for the second session if possible. But they could if they need to, you see.
So as you were talking about, utilizing their strengths and bringing about a change, I could recollect some of my training of motivational interviewing and positive psychology, where we, help people to focus on their strengths. And so, as you said, that we might not need REBT always. We might even, the client may help himself by focusing on one or the other thing that comes up during the single session. And let me try and sum up all the steps that we just talked about. And the first thing
before you do that, you see, what you're now doing is so important in the single session therapy.
Yeah.
Don't summarize the session for the client. Have them summarize it for themselves.
For you. Yeah.
So there you go. Okay, so let's hear your summary.
Yeah. So you said that the first thing is preparing the context so that the client knows that why they have come and what is it that we're going to talk about in the session. And the second thing is, you said that asking them about the goal or the purpose in different ways. For example, you gave two very good examples for that. You said that we can ask them that, what is the purpose of our talk today? What is the purpose of our conversation today? Or what is it that you would think about the session after you go home? And when will you think that the session was good for you? And so bringing them to a goal focus. And then you gave a very good analogy of the dentist, where you said that, pinpointing the problem. What is the exact problem that we have to,
Yeah. Where's the pain and what's the pain about?
Where's the pain and what is the pain about? Exactly. And then maybe come up with the solution to the problem, and then giving an opportunity to the client to rehearse the strategy that has come up, and then converting it into an action plan which he can integrate into his own life, and then having him understand that more help is available if needed, and helping him to reflect on the session that we had just had, rather than thinking about that, what will we do in the next session?
Yeah, you see, I think in a way what we're trying to do is to kind of recognize that if you like, it's a sandwich, the session, the session is the inside of the sandwich. The preparation is the outside piece of bread, and the reflection and the implementation is at the other side of the bread. So you've got this sort of like a sandwich. But you used a word there. I want to just kind of reflect on a minute, because so much of therapy now is, particularly in terms of CBT, is they use the word protocol and treatment plan and manual, and the word I use is conversation. What I'm trying to do is to engage people in a conversation about their problems. And I don't have a protocol in mind that I'm going to have them take them through because of some pre-assessment, I don't know what they're going to be talking about. So I want a conversation. I want to make it a therapeutic conversation for them. And I think the single session mindset, some of the practical implications of that mindset, which we've discussed today, enables me to do that. And the other thing is, I think that people always laugh when I say this, and I say it a bit of tongue in cheek. One of the important ingredients to be a good single session, well, two really. One is flexibility. You need to be able to be flexible, and to be able to think quickly on your feet. Yeah. Now that doesn't mean that you can't say, for example, let's suppose we're working on something and I need to I'm not quite clear, and I just say, let me just take a moment to think about what you've just said. And then I'll pause and I'll think, and you can create some time. But the idea is that we're having if you like, a conversation, and I'm thinking quickly on my feet, and my joke is that it helps to ward off dementia, because I'm really really engaging my thinking and my flexibility. So it's helping to keep me as mentally agile. I think single session therapy, people say, now what are you going to do in your old age to keep yourself mentally agile? I'm saying, I'm going to do single session therapy, because that, for me, that really helps me to keep young. So my goal is to be the oldest ever single session therapist.
Wow. Yeah. And we wish you all the best for that, Professor Dryden. And one last question before we wind up today's beautiful conversation that we had. And would you believe that we have already talked for 52 minutes, and we have only 8 minutes left in an hour.
We have 8 minutes, which means I can cure 3 people for my reckoning, if you like.
True.
Okay. So, how would you like to spend the next 8 minutes?
I was thinking about something, and one thing that came to my mind was a problem that I suffer from, and maybe can we have a quick demonstration on me?
Okay. So what do you want? What do you hope to achieve at the end of our conversation?
I want to be less sensitive to people's disapprovals.
Okay, so is there anything that's coming up that might be a good representation of the situation where you might receive disapproval?
Sometimes in India, people are obsessed with the color of the skin, and whenever I go into to a party or a gathering, I always fuss about making myself up or applying some makeup, and I worry about whether.
So what are you trying to do? Are you trying to lighten your skin or darken your skin, or what are you trying to do?
Yeah.
What? Which? Lighten or darken?
Lighten.
Okay. So let's suppose that the next thing that you go to, you don't do that, right? You just present yourself in all your glory, right? Let's suppose that. What's your fear?
The fear is that I will not get bright pictures, which I will not be able to post on Facebook, or people will say that why are you looking so dull, or something like that.
So you've got two things there. One is that you're judging you, and the other one is where they're judging you. So if we were to focus on one of those two things today, would it be that you're judging your skin color, or they're judging your skin color?
They're judging my skin color.
So what do you fear that they're going to say again?
They're going to say that, why don't you do something for your skin? Why don't you apply something? Why don't you, get some treatment.
And how are you going to feel if they say that?
I feel bad that why do they have to comment on my skin color?
Now, you've done your REBT training. You know that bad is a little vague, don't you? So what's the feeling? What's the bad feeling that you experience if they were to criticize you for your dark skin?
Sad.
Sad. Okay. Why is sadness a problem for you? Sad
because
doesn't. Yeah.
I would like to feel happy about myself. I would like to feel free. I would not like to feel be in the trap of this skin color all the time.
Right, but but that comes back to you, you see. So because let's suppose this. Okay, let's suppose that you were accepting of yourself for your skin color. Okay, let's suppose that. Would you be as affectable by these comments if you were able to accept yourself for your own skin color?
No.
So you wouldn't be as affectable, right? So really the problem is you with you, isn't it? So now we've got the problem. Let's have a look at what we know and what we don't know. We know that you would prefer to have lighter skin, right? In the same way as I would prefer to have hair, right?
Yeah.
Okay. You would have lighter skin, I'd have hair. I'm gonna bring myself into it so we can share the therapy here. Now, when you are sensitive in an unhealthy way that leads you to camouflage, because you're camouflaging it, aren't you? Is your attitude the idea that I would prefer to have a lighter skin and therefore I have to have it, or I'd prefer to have a lighter skin but I don't have to have it? What leads you to camouflaging and to feeling oversensitive?
The first statement, that I prefer to have a lighter skin and I have to have it.
Right. I prefer to have hair and I have to have it versus I prefer to have hair but I don't have to have it. Okay. Now, which attitude do you want to go forward with?
The second one.
Okay. So that means that you're going to have to acknowledge the same thing as I have to acknowledge, is that our preference is that, I'm not having my preference met, but I can still accept me for my lack of hair. Can you imagine accepting you, but still not liking the color of the shade of your skin? Is that possible to imagine that?
I accepting my skin color, but may not be liking
accepting you, but maybe preferring a lighter skin.
Yes.
Okay, so if you really want to practice that, right, then no camouflage. And the answer to that, the question would be the rehearsal of the statement when they say, why don't you do this? Is that, no, I'm working on accepting myself for the skin color that I have. People come up to me, they say, oh, why don't you wear a wig? And they say, no, I'm accepting me. I prefer to have hair, but I don't want to go the wig route. So if you really were to take that solution, and you see, the camouflage will keep it alive.
Yeah, true.
Right. So how about this? Why don't the next time you go out, that you take a picture of yourself, put it on Facebook with a little thing, I'm accepting myself as a person, even though ideally I would like to have a lighter skin, but I don't have to have it.
Yeah.
What about that?
Yeah, I can do it. I can do it tonight itself.
Excellent. Look forward to it. And we've still got a minute to spare.
Wow, that was a wonderful demonstration.
My pleasure.
And yeah, less than 8 minutes, 7 minutes.
Yeah.
Thank you
Well,
so
you see
much.
what you see what you can do if you've only got a short amount of time.
Exactly.
I didn't take a case history. I didn't do a case formulation. I didn't do anything like that. We just got straight down to it. And also, I re-cured myself as well.
Yes. Used a lot of self-disclosure, and that helped me to connect you. And that's what you were saying about the therapeutic alliance. You don't have to spend 4 sessions in creating a therapeutic alliance. You can make your client feel close to you immediately.
Right. Okay. Good. Okay. Thank you very much. It's been I have another person to see, but thank you very much. Do you have a recording of our session?
Yes. This will be available on the YouTube, and
if you could possibly send it to me as an audio via WeTransfer or something like that, I'll be grateful. Okay.
Sure. I'll do that.
Lovely.
Thank you so much. It was a privilege. Thank you. Thank you. And thank you, the audiences as well. Thank you.